I'm Dr. Michale Sumko. I have been in practice as an orthopedic surgeon in Brigham City and the community surrounding here for the past 22 years. We're talking about the basilar joint of the thumb. The basilar joint of the thumb is the joint which is very unique to man because we are the only animal in the kingdom that opposes our fingers. And that sets us apart. You have an opposable thumb, allows us to hold tools. Monkeys don't have that. The joint is structured such that it's called a saddle joint, meaning that it has, like a saddle, you can do two things in a saddle. You can slide to the front of the saddle and you can slide side to side, and that's exactly how it's formed. It's formed by two bones which have a joint which allow this motion and this motion. And in doing that, it gives us great mobility of our thumb. We're able to oppose every single finger. As I said, we're able to grasp things, which monkeys, although they have a simian hand, which doesn't have that same joint, they're unable to grasp things, so they can't grasp tools. That's what makes us obviously physically different. So what happens is when you have a joint that has that much mobility in it, it begins to wear out very quickly. In fact, it's probably one of the joints that wears out faster in the upper extremity than any other joint. When you begin to have pain at the base of the thumb, so when we look at our thumb, we see there's three joints in the thumb. One is the distal joint, one is the middle joint, and then this is the basilar joint of the thumb. That's that one that allows three motions, the motions away from the joint this way, and of course opposition. When that begins to either get swollen or tender with grasping things, then you're starting to develop that arthritis. There are some people who are prone to that. And those people are particularly people who all their life have done a vocation such as teaching. They've grasped the chalk and written on the board for years. They've corrected papers. They've opposed, their thumb has opposed their other fingers or an instrument in their hand, and subsequently that begins to wear out. About age 45 to 55 is where we start to see it wear out. Sometimes this is confused a little bit with what's called carpal tunnel. We've heard a lot about what carpal tunnel is, and I'll explain that in a moment. But the biggest thing for this particular process is pain at the base of the thumb and occasionally a little bit of numbness that comes up along the thumb and down into the wrist, because there's a little nerve that travels over that joint and occasionally it gets pinched. So some numbness, but mostly pain after you've done things for 30 minutes or so, or when you first wake up in the morning. That's the big one. You first wake up, your hand has been usually in a fist. It's not ever open when we wake up, it's in a fist, and that joint has been worked throughout the night. People wake up rubbing the base of their thumb. That's the first kind of symptoms. Now, to compare that with carpal tunnel is the nerve that runs through the tunnel right here into your hand is the big median nerve, and it supplies these 3.5 fingers. So on the palm surface, when people start to get numb and their thumb, index, long, and ring, the thumb side of the ring finger, that's the beginning of carpal tunnel syndrome. And that's typically wakes you up at night. It's numb and tingly because we all sleep with our wrists in this type of position, and that's the position that squeezes and pinches the canal off where the nerve runs into the hand. So people sometimes mistake that with this basilar thumb arthritis, but it's almost always numbness followed by pain, where this is typically pain followed by maybe some numbness. And the numbness is on the back of the thumb for the basilar thumb arthritis. First stage is just a general aching after doing things, and typically with that we begin with people starting them on oral arthritis medications. Occasionally what we'll do is we will inject that joint with some cortisone, which typically buys anywhere from 2 to 6 months of pain relief. The second and third stages is where the joint begins to wear more and more, and as it becomes more painful, we'll put people in splints at night so when they sleep they essentially have some support to that and they're not in this gripping position. So we put them in splints, give them injections, give them anti-inflammatory medications, and then there's stage 4. And stage 4 means the joint is completely worn out and the only procedure left is a salvage procedure to replace that joint. And about 40 years ago, a couple of gentlemen back in Boston, Bennell and Littler, they were both hand surgeons. They came up with a very simple little procedure, and that procedure was to take part of the tendon right here, the flexor carpi radialis, take part of it and run it into the place where that joint's worn out and use it as a spacer. Very simple procedure, but what it does is gets rid of the pain and still allows you to have an opposing thumb, but it provides a soft little cushion in there. You take the little joint out, place it with a kind of a cushion from the tendon. You're in a cast for about 4 weeks and then you start using it. And the biggest thing is the pain is gone. That's what most people love about it, is the fact that it gives them a functional thumb without the pain. Now the carpal tunnel, on the other hand, we typically begin simply splinting people at night, because sometimes if you take the hand out of this position and put it in a nice supported position, their numbness will go away. Then the next step after that is to inject it if it's not much better, get rid of the inflammation and put it in a splint. And then the final step is we do an endoscopic carpal tunnel release. Endoscope means it's a small little incision here. We stick a scope in and we take the tunnel and we widen it. We allow it to have more room so that as the nerve enters the hand, it doesn't get pinched anymore. Again, this age group is typically for the thumb is going to be 45 and above. If you're 35 and below, and your chances of having this are very slim. And if you're in an occupation where you really don't use your hands that much, the chance of having it is less. You want to ask your mom and dad, and particularly women get this, more so even than men. You want to ask the family, has anybody had this kind of problem? And most of them who have it will say, I have pain at that base of that thumb. And they'll also begin to notice a prominence. And what I mean by that is, as that joint gets arthritic, it becomes very prominent. And you'll see people who have a big lump at that joint, and they've got a worn out CMC joint. So when somebody starts to think they have this, simple questions are, do you have numbness with it? And if they say, I don't have any numbness, I just have pain, it's usually base or thumb. And if they say they have numbness, then typically it's the carpal tunnel, that nerve coming into the carpal tunnel causing numbness into here. As the numbness progresses, it becomes painful. So that's kind of the process. And then typically if you come and see us, we'll get you started on the path. We can eliminate the thumb arthritis by a simple x-ray. That's the biggest thing. The carpal tunnel, a lot of people can do a simple test, and this is real easy. If your hands go numb in 1 minute by simply doing this, putting your hands together and hold them there for 1 full minute. And if they start to get tingly in the index, long, and part of the ring finger, and particularly the thumb, you start to have carpal tunnel syndrome. And the other thing you can do is, once you've done that for a minute, is tap yourself on the wrist. And if you get tingling into your fingers, that means the nerve's unhappy, because normally you should tap that and it shouldn't cause a problem. But if you're tapping it right on the nerve, middle of the wrist, and it's tingling in your fingers, that nerve's not happy. It's had pressure, it's irritated, and subsequently it doesn't like that, and it'll give you the symptoms of tingling. There are 2 places where the nerve to your pinky comes from, and all of us have done this. All of us have hit our crazy bone on something. Well, that's not the bone you actually hit. You hit the ulnar nerve as it goes between this bone and this bone. Here's a little canal right there. That's called your cubital tunnel, as opposed to your carpal tunnel. The cubital tunnel, the nerve rounds the bend there, comes down through these muscles and enters the hand on this side, and it gets the small finger and the small finger side of the ring finger. So those 2 fingers. So when people have numbness in that, it's typically because what's happened is, as this nerve goes around this bend, it gets entrapped in that little tunnel. And people will find themselves with, basically at night, they'll sleep with their arms folded, and they'll wake up through the night and their small finger and ring finger are numb. And they'll straighten their arm out, shake it, numbness will go away. They'll go back to sleep an hour or 2 later, same thing. And particularly if they're during the day, they're driving or they're doing something where they're resting their arm on the chair, and their fingers, those 2 fingers start to go numb, it means that they have cubital tunnel. And so we see that in any age group. It can be any time. In fact, I've seen people who've been in school. They're studying all the time. They're sitting in chairs with arms on them. They sit there, relax it right on the nerve. The nerve gets irritated. They begin having tingling in their fingers. And the primary test for that is, if a person wants to know if that nerve's being pinched, is to fold their arm up as tight as they can, like they're doing a biceps, and hold it there again for 1 minute. If they start to get tingling in those two fingers, that means that nerve is being stretched. So we begin with simple treatments such as, again, anti-inflammatories. We splint them at night in extensions, so we won't let them sleep with their arm bent. Put a little splint on, keep it straight all night long. If the numbness and stuff starts to go away, we just, for 30 days, we'll have them splint them at night in that position so they don't bend it and irritate the nerve. Those are the basic, simple things. Worst case scenario, the numbness and tingling gets there all the time, constantly, bent arm or not. In which case we do a little release where we release the nerve going through the canal and take the pressure off it and allow it to, the failing to come back. All the surgeries we've talked about so far are all same-day surgeries, right? Carpal tunnel release, the CMC arthroplasty, and the release of this ulnar nerve. All same-day surgeries, simple things. We typically do a nerve test prior to that to make sure that's the problem, and it's not the nerve being pinched up higher in the neck area, which can happen. Most cases, 99% of the time it's here, 1% of the time it's up higher. You can actually do some things that where you stretch for carpal tunnel, you're stretching the wrist this direction. It keeps the pressure off of the nerve. As remember we said, this direction puts pressure on the nerve, this direction takes pressure off the nerve. So the more things you do with your wrist back keeps the tunnel open. And those are kind of stretches. So yes, you can do these kind of things. That helps a little bit. But because it's a structural problem, because it goes through a tunnel and that tunnel is narrow, you can stretch all you want, but Mother Nature is going to kind of, as soon as you're done stretching, that tunnel takes its same old typical shape. So the chance of stretching that without actually surgically going in and opening the tunnel up is very slim. Same thing here. Opening that tunnel up almost has to be done surgically because it's an acquired process over years. You don't see this in kids. 10-year-old kids don't come in with carpal tunnel syndrome. It's a process that's acquired over many years. When you typically replace that nerve, or decompress a nerve, take pressure off of it, it's like a garden hose. You have a garden hose and your car is parked on the garden hose. What happens at the end? There's no fluid, there's no water running out. You take the car off of it and the pressure may not be perfect when you immediately, meaning that hose has taken that form for a while. After it's off for a very short period of time, the pressure at the end becomes normal. Same thing happens with these nerve decompressions. Almost always they're about 100%, 99 to 100% relief. And with the CMC arthroplasties, those are virtually 100%. If you get to stage 4 and replace it, the worst arthritis, the chance of having 100% relief is significant.